Welcome, everyone. Good afternoon. Thank you for joining us for I believe it's our eighth town hall, where we will hear about clinical supervision. And the purpose of the town halls is to provide information to registrants and other system partners on various topics of interest. All of these town halls are recorded and posted on the CRPO's YouTube channel. The slide decks are also posted on the website under the latest news posts. So if you have missed any and you would like to go back and revisit those presentations, they are available. And you'll also, on the town hall page on our website, note that we circulate the links to the surveys where folks can ask questions on the related topics. And those questions are incorporated into the presentation slides today. So thank you to those who submitted questions. And speaking of questions, if you do have any questions during the session, please use the Q&A feature on Zoom and staff will respond to questions. That way, we do hope to have some time at the end to answer any questions live, but if questions come to you throughout the presentation, please use the Q&A feature. And finally, just a reminder to please keep yourselves muted for the duration of the session, and you can also disable your video feed if you'd like. And with that, I will pass it over to Michael Mackin, CRPO's Vice President, to provide a land acknowledgement and some opening remarks.
Good afternoon, and thank you, Amy. So welcome to the CRPO's second last town hall meeting of the 2024-2025 registration year. It's wonderful to have had this opportunity to share information with registrants on several occasions. Today's topic, as Amy's already said, is clinical supervision, a review and what's new. As we begin today, please join me in acknowledging the Indigenous peoples of all the lands that we are on today. While we meet on a virtual platform, I'd like to take a moment to acknowledge the importance of the land which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast, we acknowledge the ancestral and unceded territory of all of the Inuit, Métis, and First Nations peoples that each call this nation home. Please join me in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how we can each, in our own way, move forward in a spirit of reconciliation and collaboration. Just a reminder about this town hall series, as Amy has already commented, but we've held 6 English and 1 French town hall to date, covering a variety of topics. The recordings, as Amy's already mentioned, of these sessions are all available on the college's YouTube channel if you're interested in any of them, or all of them. You can see we have 1 more session planned for March on diversity, equity, and inclusion, and please stay tuned for the exact date. We will also be excited to announce in the near future the next series of town halls, so please keep an eye on our communique and website. We have received questions in advance of this presentation, and we have integrated those answers throughout the presentation. So thank you to those who have taken the time to pose questions and send them in. Any new questions that we don't get to answering today will be included in a summary of the town hall meeting today and made available on the college's website. Clinical supervision is a key component of the professional training and formation of registered psychotherapists. It continues well beyond initial training and serves along with consultation as a means of ongoing professional development, maintaining professional relationships, safeguarding client well-being, and ensuring safe and effective use of self. Today's staff will walk through longstanding policies related to clinical supervision, as well as some new and upcoming developments. In 2021, the college, the CRPO, carried out a comprehensive clinical supervision policy review, which resulted in recommendations. You will hear about these in the form of new initiatives that are in the process of being implemented. Underlying these changes is something we have spoken about many times. The underlying principle is the CRPO's right touch, risk-based approach to regulation. This approach uses the least amount of regulatory force required to ensure safe and ethical use by registered psychotherapists. Applying this to clinical supervision, we have continually had to balance over the years the perspective, on one hand, of those who advocate for open-minded, or open-ended rather, barrier-free access to providing and receiving clinical supervision, with those who emphasize the highly specialized and risky nature of providing appropriate clinical supervision. As we cover the content, I hope you will appreciate our efforts at finding an appropriate balance, protecting the public interest, promoting fairness to those who wish to provide or receive clinical supervision, and respecting the diversity of the profession. Our work also reflects the evolving nature of the profession over the years. It has been nearly 10 years since registered psychotherapists have been part of the regulated profession in Ontario. As registered psychotherapists grow into a vibrant, respected, and much needed group of professionals, the requirements around clinical supervision illustrate the professional standard to which registered psychotherapists hold themselves accountable. And with that, thank you, and I'll turn it over to Pam.
Thank you very much. My name is Pam, and I'm a policy analyst here at the college. Today, we're going to be taking you through a review of the current expectations and materials related to supervision before providing an update on what's new. We'll then take you through some common questions we received in the survey, as well as their answers. Moving on to the content, I thought it might be helpful to discuss what clinical supervision is to start. CRPO defines clinical supervision as a professional relationship where the individual who is receiving supervision is engaged in a collaborative learning process with the clinical supervisor, which relationship is designed to promote the professional growth of the supervisee, enhance the supervisee's safe and effective use of self in the therapeutic relationship, foster discussion of the direction of therapy in the therapeutic relationship, and safeguard the well-being of clients. Moving on, clinical supervision has the following characteristics. It is contractual, it is purposeful, records are kept by both the supervisor and the supervisee, there are meetings scheduled at regular intervals according to the needs of the supervisee, and the ultimate focus is on the well-being of clients. To count clinical supervision hours for CRPO registration purposes, only the time spent in meetings between the supervisor and supervisee is included. Meetings may be in person or virtual. Time spent with clients, even if the supervisor is present or at work with the supervisor on call, are not considered clinical supervision hours. Informal peer supervision, i.e., the unstructured discussion of clients with colleagues, is not considered an acceptable form of supervision for registration purposes. Moving on, there are a handful of other forms of oversight. In addition to clinical supervision, there are other forms of oversight. Clinical supervision is distinct from the following forms of support and oversight, although it may incorporate some elements from each. Administrative, managerial, or workplace supervision occurs when there is oversight of the operation of a business, clinic, practice, or other organization. It may focus on topics such as programming, finance, performance, scheduling, record keeping, and marketing. Teaching is assisting with learning, for example, by providing instruction. Mentorship occurs when one is helping a less experienced practitioner grow over time, for example, by providing advice, information, or sample cases. Finally, there is consultation. Consultation is obtaining direction or advice regarding the way forward with a particular client, clinical issue, or issue related to professional practice. The college is aware that some younger professionals who may not qualify as clinical supervisors may occasionally take on these roles. As always, professionals offering these services should uphold Standard 2.1. This includes ensuring any clinical advice or information provided is based on reasonable professional opinion and only offering services within their skill, knowledge, and judgment to provide. Before we get too far in, I do want to highlight 3 of our professional practice standards that explicitly reference supervision. First, we have Standard 2.1, which requires supervision and verifiable education prior to expanding one's practice area. Standard 4.1 provides the expectations for supervisors, noting registrants may only provide supervision if they are qualified to do so, and that supervisors appropriately supervise persons that they are obligated to supervise. In the commentary of this section, registrants can learn more about the responsibilities of clinical supervisors, expectations for the clinical supervision agreement, including ideas on what to put in the agreement, record keeping, and professionalism, among other topics. Meanwhile, 4.2 outlines expectations for complying with requirements to undergo supervision. Again, the commentary of this standard can be a useful tool in understanding responsibilities related to the frequency of supervision, supervision records, and informed consent and confidentiality. These revised standards came into effect on January 1st, 2024, and there are no anticipated upcoming changes. So, for example, it is not expected that supervision record-keeping requirements will change in the next couple years. The current status and requirements for supervision, as well as upcoming changes, will be discussed a little later on. Moving on, there are several types of supervision an RP may undertake. First, there is individual supervision, which is one-to-one. Individual supervision promotes focus and oversight. Dyadic supervision occurs when one supervisor meets with 2 supervisees at the same time. It can exemplify couple dynamics for those working with coupled clients, though it is not necessarily restricted to that purpose. Group supervision occurs when one supervisor meets with 3 to 8 supervisees. The number of acceptable supervisees does not grow with the addition of a co-supervisor. For registration purposes, a group supervision arrangement can have a maximum of 8 supervisees. Dyadic and group supervision allow supervisees to learn from one another. Group supervision is less likely than individual or dyadic to justify the sharing of identifiable client information. When group supervisees share the situations they've encountered, it is generally on a without names basis. Moving on, there are a number of reasons why an individual may undergo supervision throughout their career. Many students in Ontario psychotherapy training programs plan on registering with CRPO. Students in psychotherapy education programs that are recognized by CRPO or are substantially equivalent to a recognized program are eligible to register once they have substantially completed the program. Recognized and substantially equivalent psychotherapy education programs are expected to have a clinical placement or practicum component where the student begins providing therapy to clients under supervision. One of the main reasons students, applicants, and registrants receive clinical supervision is to fulfill CRPO registration requirements. The vast majority of CRPO applicants do apply via the recognized or accepted program route or the non-recognized program route. These applicants are initially registered in our qualifying category. Other registration routes do include the Indigenous pathway, labor mobility, temporary, and emergency categories. We are focusing on the recognized and non-recognized education program registration routes. Qualifying registrants are required to practice with regular clinical supervision. After transferring to the full RP category, they are required to continue practicing with clinical supervision until they qualify for independent practice. That is, having successfully completed a total of 1,000 DCC hours and 150 clinical supervision hours, counting from the start of their psychotherapy education program. As required by Standard 2.1, registrants may also undergo supervision in order to expand their practice area. Of course, undergoing supervision may be a choice by a registrant at any point in their career for the purposes of professional development or growth. And finally, a registrant may be required to undertake supervision as directed by the college. Moving on, as part of the CRPO registration process, supervisees require confirmation of their clinical experience hours. Confirmation of hours may come from a supervisor, employer, or educational institution. For practicum students in a program with clinical experience recognition, the school will confirm practicum hours directly with CRPO. In all other cases, the forms linked on the slide are used. For supervisees who operate a solo private practice while receiving clinical supervision, they do not have an employer to confirm hours, and they would require their clinical supervisor to confirm the hours. CRPO's DCC confirmation form requires the signatory to confirm hours to the best of their knowledge, information, or belief. CRPO's Clinical Supervisor Attestation Form, which is linked in this slide, provides a convenient template allowing the supervisor to attest to their qualifications, confirm the supervision provided, including the format and number of hours, and verify that the hours were successfully completed, meaning the supervisor believes the supervisee acted in a safe, professional, and ethical manner. Supervisors may be contacted to verify information, and records may be reviewed. We hope this answers a question we received about how CRPO verifies hours. In a moment, you'll hear about what's new. The wording of these forms may be slightly updated, but there's not expected to be more paperwork required to confirm hours. I will now pass it over to Mark, who will take you through some updates that have been made in regard to supervision.
Thank you, Amy, Michael, and Pam. Good afternoon, everyone. I'm Mark Pioro, Deputy Registrar and General Counsel at CRPO, and I'm going to be talking about what is new. You can see the topics listed here on the slide. When we send the slides out, these will be links which you can click for more information. And of course, we'll get into more about each starting on the next slide. So first, I'll be talking about the revised clinical supervisor criteria, beginning with the in Ontario component, as we need to be somewhat more flexible for individuals outside Ontario who may have completed their supervision or provided supervision without being aware of CRPO's requirements. So in fairness, these main criteria apply to supervisors in Ontario. What you see on the screen is coming into effect April 2026. I'm going to go over each item carefully in detail because if you are familiar with the existing criteria, you'll want to know what is staying the same and what is changing. Beginning with number 1, registered in good standing with a regulatory college whose members may practice psychotherapy. This is the first expectation, and it is not changing. It is exactly the same. And just for clarity and information, those colleges that a supervisor in Ontario may belong to are nursing, occupational therapy, physicians, psychology, social work, and of course, RPs with CRPO. Number 2 has a relatively small timing-related change. That is the 5 years practicing psychotherapy requirement. So the change is that after careful deliberation, it was concluded that those 5 years should be counted from graduation from the supervisor's psychotherapy training program. Someone asked, what about work experience before my MA, for example, in case management and treatment implementation? While I don't have all the information about this person's situation, it sounds like this was before graduation from one's psychotherapy training. So under this definition here, under number 2, and the timing, it doesn't sound like it would meet the expectation. Again, 5 years from graduation from psychotherapy training. Number 3, this is the same as before, meeting the independent practice requirement. One person asked if a qualifying registrant can provide clinical supervision. So under this criterion, which is not changing, the answer is no. It's expected that they have met the criteria for independent practice. Number 4 is the biggest change, but let me explain carefully because some parts are the same and some parts are different. So it's always been the case that, or for several years anyway, CRPO expected supervisors to have 30 hours of directed learning in providing clinical supervision. So there's always been several options on what those 30 hours may constitute. It could be a course or some other form of mentorship or directed study. And Now, to describe the change, we can divide it in terms of new and existing supervisors. So for existing supervisors, that is, for individuals who began providing clinical supervision before April 1st, 2026, they already have taken some form of 30 hours of directed learning. Maybe they've taken a course, maybe it's something else. So that is staying the same. So to be clear, you could sort of think of this as a kind of grandparenting, if you want to use that terminology. They're not being expected or required to take a course. However, if they want to do a refresher or an upgrading, that's always encouraged. That's in the spirit of continuous improvement. They're welcome and encouraged to take a course, especially if they haven't taken a course. They're welcome and encouraged to take a course on providing supervision. One person asked, do you need to be providing supervision before April 1st, 2026, or just qualified? So the wording suggests the former, began providing clinical supervision. So the second half of that is anyone starting to provide supervision April 1st, 2026 or later. These are the individuals for whom it is expected that they have completed, or they will have completed, a 30-hour supervision course. So I hope that clarifies what the change is, what's staying the same, who it applies to, and so forth. Now, number 5, this is new, and it applies to all supervisors, complete CRPO's learning module on clinical supervision, and I'll talk about that in a moment. But first, if we go to the next slide, we'll cover, as I mentioned, the outside Ontario component of the definition. And here, we've just made a relatively minor clarification. So outside Ontario, a supervisor is an experienced practitioner of psychotherapy, qualified, and this is the change, just a clarification, generally by another regulator in a regulated jurisdiction. So that's clarifying that if the supervisor is somewhere where psychotherapy and supervision is regulated, then they should generally meet those requirements. And if they are in an unregulated jurisdiction, then they should generally meet the requirements of the predominant or applicable professional association in that unregulated jurisdiction. A brief note about cross-border supervision. It is generally allowed, and hours will count for CRPO registration purposes, regardless of where the supervisor, supervisee, or clients are located. However, for more information, we would suggest that you consult CRPO's various resources on cross-border practice. For example, our Practice Matters webpage and articles, our cross-border therapy tool, and our cross-border electronic practice webinar. Now, if we go on to the next slide, and this might answer one of the questions that came in about recommended courses. So CRPO recently approved, December 2024, new supervision course guidelines. And so in answer to the question, CRPO does not currently pre-approve, accredit, designate, list, or even recommend supervisors or supervision courses. The course guidelines will assist course providers, new and experienced supervisors, and others promote excellent supervisor education. And in answer to a question we received, the guidelines are not strict requirements, but they're recommendations that hopefully the professional community will benefit from and make use of. I'm reading a question that most supervision courses require individuals to already be providing supervision. So thank you for that feedback. We'll look into that. It's certainly not the college's intent to put potential supervisors in an impossible situation where they need the course to supervise, but they need to supervise to take the course. There will be a reasonable solution to that dilemma. So we'll look into that. Moving in on to the next slide, I'm going to talk briefly about the supervisor learning module, which relates to that criteria number 5, a couple of slides back. And this applies to new and existing supervisors, but I want to emphasize that it's going to be short. So when we talk about a supervision course, it's 30 hours. But when we talk about this module, it's 30 minutes at the most. And it's short, and it's free, it's online. It's not meant to be a barrier, but rather to bring everyone up to speed about CRPO's registration requirements and policies around supervision. It'll be available, we hope, in the spring of this year. It is accompanied by a guidebook, which is already online that people can read. And we hope most or all supervisors have had the chance to go through this by just over a year from now. And then going on, I want to talk about our relatively new, not brand new, it's been around for a few months at least, clinical supervision tool. Originally intended to help prepare candidates for the CRPO registration exam, it can be used in a much broader way for general learning and evaluation. And as you can see here on the slide, it's composed of 5 reflective modules. And there's going to be links there that you can click to have a look at the tool. And now I'll pass it back to Pam to start going through our Q&A questions.
So the first question we received was whether or not CRPO approves clinical supervisors. And no, CRPO does not pre-approve clinical supervisor training activities, nor does CRPO maintain a list of approved or qualified clinical supervisors. Similarly, CRPO does not grant the designation of supervisor or clinical supervisor. RPs should not use titles such as CRPO approved supervisor, CRPO clinical supervisor, or RPS. Registrants should not declare that they are certified or approved by CRPO for the purposes of supervision. There are also no current plans to do this. However, in the long term, we do periodically review all of our policies. Will things become more stringent in the future? We can't predict, but we will continue to consult with registrants and system partners. We were also asked, how does one become a clinical supervisor? As of April 1st, 2026, the following requirements must be met for Ontario supervision. An individual must maintain good standing with a regulatory college whose members may practice psychotherapy, complete 5 years extensive clinical experience practicing psychotherapy after graduating from an education or training program, meet independent practice requirements, complete 30 hours of directed learning and providing clinical supervision, and complete CRPO's learning module on clinical supervision. They do not need to contact CRPO for approval to provide clinical supervision. Therapists who wish to provide supervision are encouraged to continue to develop their competence in providing clinical supervision so that they can provide supervisees with the richest possible experience. They are encouraged to rely on their professional judgment to identify appropriate training activities using CRPO's clinical supervisor definitions and standards for guidance. Moving on, another common question was who is liable or responsible for the client? CRPO standards 4.1 and 4.2 require registrants to set out the details of their supervisory arrangements in a written agreement. Among other things, the agreement should clarify who has ultimate responsibility for clients. The sharing of responsibilities should be reasonable in the circumstances and considering a variety of factors, including but not limited to the training and experience of the supervisee, the practice setting and available support, and the client population and potential population risks. It is also important to distinguish between legal liability and professional responsibility. Legal liability involves complying with legislation like the Ontario Human Rights Code or Occupational Health and Safety Act, and the possibility of being sued in civil court. Professional responsibility involves how CRPO would view the situation if someone filed a complaint or report. In short, supervisors are responsible for the supervision they provide and for following the CRPO practice standards. If the supervisor or supervisee belongs to a regulatory college other than CRPO, they might have their own requirements about who takes primary responsibility for the client. One college might require that the supervisor take primary responsibility, while another may expect the supervisee to have primary responsibility. CRPO's flexible position allows for either situation, providing that the decision is reasonable, the supervision agreement is clear, and clients are informed about who is responsible for their care. Finally, we note that things can get very complicated. For example, if a supervisee works at a group practice, they may have an internal manager and an external supervisor. Should their employer verify they are receiving supervision? We can't speak for employers or give business advice, but in general, it sounds like a good idea. If things go wrong, it would be important to obtain legal advice. Liability cannot be determined in advance. Or let's say you are considering being an external supervisor of a student in a private practice. Is that too much risk to take on? Are you going to be able to have enough oversight to fulfill your role meaningfully and effectively? Again, these discussions need to be held in advance and legal advice obtained. When considering liability, it's important to note that there are ways to manage both the potential liability to the supervisor and supervisee. First, registrants should always practice according to the professional practice standards, and supervisors and supervisees should make sure the other is doing the same. You should review your PLI to make sure you are effectively covered, and when necessary, as we previously mentioned, seek legal advice. CRPO doesn't expect liability to change in a significant way based on the policy updates we've discussed today, but if you face a contentious situation or are planning your business structure or contract templates, it is best to obtain legal advice. Moving on, you may also be wondering what adequate supervision is. What that means exactly will vary case by case. What the supervisor and supervisee agree upon at the outset is an extremely important factor for determining their respective responsibilities. By addressing these questions up front in the written supervision agreement, expectations during the relationship will be clear going forward, and dilemmas can be prevented in advance to some extent. Ultimately, each participant in the supervisory relationship is responsible for their own actions and for abiding by the professional practice standards. If a supervisor is unable to fulfill the supervision agreement or they do not have the necessary competence to supervise a certain area of practice, they should seek consultation or supervision of supervision or refer the supervisee to another supervisor. If a supervisee is not receiving adequate supervision in terms of frequency or practice area, and they are unable to resolve the issue directly with the supervisee should consider consulting with their education program, faculty, or practicum provider and request a transfer to a new supervisor if they are a student, or they can take appropriate steps to find a new supervisor. In more serious cases where inadequate supervision has been provided, individuals may consider a complaint or report. CRPO investigates complaints and reports about RPs, whether they are supervisors or supervisees. If the supervisor is not a CRPO registrant, a complaint could be made to that person's regulatory body, but not CRPO. Also related, how can a member of the public verify a registrant is receiving supervision? Their public register profile indicates whether they are required to provide supervision. A client can always ask a registrant who their supervisor is and to talk to them, and if not given an adequate answer, they can decline to receive services or contact CRPO. We are not aware of other regulators, nor do we plan to list everyone's supervisor on the public register. We also received questions asking what a supervisor should do if they have concerns about a supervisee. CRPO encourages supervisors to first address any professionalism issues with the supervisee involved. This may involve a discussion regarding clinical supervision or additional training to ensure that the supervisee understands and adheres to the professional practice standards as set by CRPO. Supervisors should document their communication and any remedial actions taken to address the issues. If the concerns persist and the supervisee is a student, the supervisor should consider escalating the matter by contacting the educational institution directly. The supervisor should communicate the specific issues, the steps taken internally, and the need for intervention to address the student's behavior and uphold professional standards. A system for ongoing monitoring and supervision of student placement should be established to prevent similar issues in the future. In rare situations where clients are exposed to a risk of harm, supervisors should consider if a report to CRPO is required. In complex or contentious situations, supervisors should obtain their own clinical or legal advice. Moving on, some registrants are also wondering if an RP can have more than one clinical supervisor. A CRPO registrant may have more than one supervisor. The question of who bears the ultimate responsibility depends on the circumstances. Several situations may involve working with multiple supervisors, for example, multiple employment sites. An RP may have different supervisors for different employment settings, for example, one for agency clients and one for private practice clients. Individual versus group supervision. An RP may work individually with one supervisor and participate in group supervision with another. Co-supervision or collaborative supervision. This involves more than one supervisor sharing some aspects of responsibility for supervising a particular supervisee. Whichever situation is involved, there are important considerations when there is more than one supervisor. The clinical supervision agreement should clarify the responsibility of each supervisor. If one supervisor is to be responsible from answering questions from clients, this should be specified. If the supervisee will be sharing personally identifying client information with more than one supervisor, they must obtain client's informed consent for each supervisor. Supervision meeting records should also indicate which supervisor met with which supervisee. Moving forward, you may be wondering about how professional boundaries apply to the supervisor-supervisee relationship. Much like the client-therapist relationship, there is a power imbalance between clinical supervisors and supervisees. It is important for supervisors to recognize the inherent power imbalance that exists and create an environment where supervisees feel safe. Establishing and maintaining clear professional boundaries contributes to safe and effective supervisory relationships. This includes being aware of self-disclosures that may be perceived as personal and unprofessional, avoiding communications that might suggest the relationship is personal rather than professional, and being careful when discussing client care issues. Standard 4.1 explains that many of CRPO's practice standards apply, by analogy, to providing clinical supervision. For example, clinical supervisors avoid conflicting roles with supervisees, such as dual personal professional relationships, or supervising and providing therapy to the same person. Sexual misconduct, undue influence, and abuse towards supervisees are always unacceptable. Clinical supervisors maintain confidentiality subject to agreed-upon limits of information provided by supervisees, and clinical supervisors make mandatory reports if supervisees engage in unsafe practice. For clarity, unsafe practice does not refer to any mistake or error. It is an acceptable part of a supervisee's learning process to share and learn from mistakes. Rather, unsafe practice refers to professional misconduct or incompetence that places clients at risk. Moving on, another one of the key questions we've received is, will CRPO accept supervision of or by a family member? CRPO does not accept supervision of or by family members for registration purposes. Even if supervision is not for registration purposes, registrants should reflect carefully before placing themselves in this situation. Supervision of or by a family member is a dual relationship and may be a conflict of interest. It may involve role confusion, transference, and countertransference, and challenges in ensuring impartial professional communication, evaluation, and accountability. On a loosely related topic, one survey respondent asked if it is ethical to receive supervision from an employer. This is not specifically prohibited by CRPO standards, and in fact, it may be quite common. However, if for whatever reason in your situation this creates a conflict of interest, you would want to carefully assess the situation. Remember that a conflict of interest is any situation that, whether actually, potentially, or in a reasonable person's perception, interferes with your ability to exercise professional judgment. So, to give a blatant example, if your employer is always talking to you about how to maximize revenue, it may be difficult to engage in clinical supervision with the same individual. Moving on, we've also received questions pertaining to whose name should go on receipts in the context of supervised practice. CRPO requires that the name of the registrant who provided services to the client be listed on the receipt. It is not a CRPO requirement to include the name of the clinical supervisor on receipts. A registrant may choose to do so. However, the billing process must clearly identify who provided the service, i.e., it should not falsely imply that the supervisor was in the client session. Qualifying registrants must practice with clinical supervision and actively pursue meeting the registered psychotherapist requirements within specified timelines. CRPO is aware that some insurers require proof of supervision and will accept a supervisor's name on receipts for this purpose. It is important to clarify any such requirements with the relevant insurance company. If an invoice includes a supervisor's information, the expectation is that the supervisee and their supervisor would have ensured the document is accurate and complete. This means that the supervisor must verify the services provided. A supervisor's registration information should not be included on any documentation without explicit agreement and sign-off on the specific sessions being billed. I will now hand it back over to Mark, who will take you through the remaining questions.
Thank you, Pam. I want to address a couple of things before what's on the slide. I answered a question in the chat and I realized it might not be clear what was being discussed. So the question was, if somebody had 5 years of experience practicing psychotherapy, then when the new definition comes in April 2026, you calculate from graduation, and for some reason it works out to less than 5 years. Well, then what happens? So I answered, I don't think it would be a major issue if the person were just a few months short. However, we don't want to see someone trying to take advantage of this as a loophole, or suddenly see that they're many years short of meeting the requirements. So if that's the case, the person should reflect carefully on their level of experience. And next, there's a very wide sweeping question about how is CRPO ensuring the well-being to new registrants, given that the college is not responsible for regulating supervision. Now, we should be very careful to emphasize that CRPO does regulate RPs providing supervision. There's the standard 4.1, which we discussed. Registrants are accountable for their conduct, even as supervisors. Now, if there is a supervisor from another regulated college, then they would be accountable to their other college for their conduct. And in extreme circumstances, CRPO could stop accepting supervision from a certain individual, but that would be very rare. I don't know if the question is getting at why is CRPO not sort of listing or pre-approving supervisors, and the answer there is that it would be a bureaucratic process that might impose some inconvenience to everyone involved, and so that decision is not being made lightly. I'd like to go on with some of the written questions here. I'll come back to people with hands up at the end. I hope we can make good time. So who should review and sign documents? I won't spend much time on it, but you can see of criteria here on the slide. Moving on to the next slide, who is responsible for the client record? Again, I don't need to spend too much time on this other than to say that it should be made clear, both in the supervision agreement and in informed consent discussions with clients. On the next slide, it asks, will not sign off on ours. This is a significant thing that happens from time to time. It's unfortunate when we hear of these difficult disputes or situations. We are trying to emphasize today that there's a fine tightrope balance where supervisors do need to be satisfied that hours have been ethically, professionally, competently completed. They have to be satisfied, but at the same time, they must not misuse that position of power arbitrarily, for example, in financial disputes as leverage and so forth. So it's always ideal to avoid these disputes and prevent them and resolve them between the two parties, because if CRPO gets involved, like in complaints, then it could be a long, complex process and the outcome is uncertain. The next question is about HST. While CRPO does not provide tax advice, we do take the position that supervision provided by an RP to enable client care, to promote client care, safe client care, is part of the scope of psychotherapy and therefore doesn't incur HST. The next question is, should a student's rate be lower than their supervisor's rate for therapy? So as we often say, CRPO does not set fee amounts for registrants. Rather, they need to be non-exploitative, non-excessive. And so the factor at the bottom about the training and experience and career stage of the registrant does suggest that less experienced practitioners generally charge less, though there are other factors at play. And the next question is, can a registrant who is required to practice with clinical supervision operate their own solo private practice? So the requirement to practice with clinical supervision is business model neutral. A registrant, including an RP qualifying, can operate a private practice as long as they have an agreement with a supervisor to oversee them and they're competent to do so. There could be some risks involved, like if they're not competent to run a business and see clients, or if they're sort of withholding key information from the supervisor. So a strong supervisor and a strong supervisory relationship and supervision agreement is essential to ensure that the person gets support and oversight, even if the business vehicle they are using is a private practice. And CRPO will continually review and assess this situation to see if any changes are needed. So now we get to near the end, and we were asked, why are these called town halls if we're not taking questions? And that's fair. Our presentation is in fact based on many questions we received in advance. We need time to research and organize our answers. We also have limited time, and it's slightly more difficult to interact in a virtual format. I understand, and please stay tuned, the next series of town halls may very well have an in-person component to them, so we'll let everyone know about that.
Thank you, Mark, and thank you to all the staff that worked hard on completing the presentation, especially Pam and Amy. And thank you to all of the people that have taken the time today to attend the presentation on supervision. So official thanks to all attending today, and I hope you found the presentation useful. It sounds like by the questions that people did find that the information was useful. Again, this presentation will be posted on the college's YouTube channel, and the slides with live links will be available for everyone. So please continue to engage with the college, whether it's through the practice advisory, by attending peer circles, by including some regulatory focused activities in your professional development, and to ensure that you have the information you need to practice safely and effectively. We look forward to seeing you at the final town hall of the year and at future events. Thank you again for your time.